Hi, welcome to my channel. I'm here again. I'm Nurse Chimax, also known as Queen Chimax. You know how we do it. Subscribe to this channel, like this video, and share it. The whole world will know what's popping here. So today I'm going to talk about what you need to know about hepatitis. Okay, what's hepatitis? Hepatitis simply means inflammation of liver cells. Yeah, and over 300 millions of people are living with hepatitis virus. Yes, so it's actually important I talk about it. So what are the signs and symptoms of hepatitis? The signs and symptoms of hepatitis, they are actually kind of general. Like, we have different types of hepatitis ranging from A to E. So their symptoms is kind of like, listen to the symptoms. The symptoms include abdominal pain, that's the location of the liver. If you palpate the liver there, if you touch there, if you press there, the person is going to complain pain. Loss of appetite, unexplained weight loss, yellow skin and yellow eyes. You know what this one means? This is jaundice. Okay, dark urine, fatigue, that's tiredness. Then flu-like symptoms. Then we have pale stool, we have itchy skin, we have muscle and joint pains, we have malaise, we have dark urine. So the next point we are going to talk about, hope you got all the symptoms. If you not get it, you watch it again. The types of hepatitis we have is ranging from A to E. So that is, we have hepatitis A, hepatitis B, C, D, and E. And to make it simple, the causative organism, that's the causative virus, is named after them. Like hepatitis A is caused by hepatitis A virus, hepatitis B is caused by hepatitis B virus. So with C, D, E. Hope you understand. So that's so simple and easy. The next point we're going to talk about is causes of hepatitis, like causes of the different types. Since there are different types, the causes won't definitely be the same. So causes of hepatitis. Okay, I'm going to group them because some of them, their causes are similar, like A and E. Remember I said hepatitis is A, B, C, D, E. So I'm grouping A and E because the causes, how it caused, is the same. Hepatitis A and E is simply caused by consuming food and water that is contaminated by infected feces. Yes, consuming food and water that is contaminated by the feces of an infected one. You think it's complex? Maybe you'll be like, well, how will I go and eat somebody's feces? But it's very simple. Like now, okay, imagine those people that sells vegetable in the markets. Okay, maybe they went to pool, they did not wash their hand very well. They will now handle the vegetables. Vegetable is even far because I think we tend to wash it. Maybe we tend to wash it very well. Maybe fruits, people that sell fruits, they, after doing everything, they will now use that same hand and handle our fruits. And some people, once they get fruits, they don't wash it. Not just washing, they don't wash it very well, not knowing that this is the person that the seller actually, maybe the seller has hepatitis A and E. Do you understand what I mean? So is now infected, the fruit is infected. Okay, another scenario now is maybe in a stream. Now we all know that some villages now, their source of water is through stream or river. Maybe somebody that's infected with hepatitis, whatever, hepatitis A and E, will now go and pull inside the river. Do you understand? Or maybe go and pull somewhere that the erosion will sweep it into the water. Have you seen? So this transmission is not really hard. But when I say drinking water or eating food, that you'll be like, no, it's not possible. But if we go into it, you know that it's actually possible and very easy. So the next one I'm going to talk about is B and C. Remember the A and E I talked about? I said it is only drinking water and food and eating food that is contaminated by the feces of an infected person. Okay, that means that if someone's food or water gets contaminated by feces and the person is not infected, you won't get hepatitis A and E. I don't know if you are making sense. Okay, so that's it. So the next point is B and C. So B and C, how do people get B and C? B and C is simply contracted. It's contracted through contact with body fluids. So what are these body fluids? These include blood, these include vaginal secretion, these include semen. Okay, so once you come in contact with all this, you can actually get infected with hepatitis B and C. Please don't mix everything up. What I'm talking about now is B and C. What I talked about before is A and E. So to this one now is B and C, which I said is contact with infected body fluids. Yes, contact with infected. This infected is very important, because when you come in contact with somebody's semen, vaginal secretion or blood, and the person is not contaminated, so the person doesn't have hepatitis B and C, you won't get hepatitis B and C. It's not magic. So the person that is giving the infection must have the infection, so the person must be infected. Okay, so how do people just go about with this contact of this body fluid? First of all is unprotected sex. When we have unprotected sex, you tend to come into contact with the vaginal fluids, the semen, everything. Then the next point is sharing needles. When you share needles, maybe this is common among drug addicts. That's why some drug abusers, those that do drugs, most of them have hepatitis, because they don't know. Some may use this method. Bros, now you understand? So sharing needles, tattoo with unsterilized equipment. Yes, when you use those people that do tattoo. So when you are going, and as a learned person, after watching this video, you want to get a tattoo, make sure the equipment is sterilized. So once someone because I said it's blood, when they use tattoo, they can come in contact with someone's blood and they now use it on you, infection is definitely going to take place. Then needle prick. This actually happens in the hospital. It can happen elsewhere. Maybe the nurse is trying to administer an injection to someone. You can have a needle prick, and the person and this happens when the needle has gone into an infected person, and you now use it on yourself. And how will I explain this? I don't want to confuse people. Like needle prick, how you get infected with needle prick is once the needle has pricked an infected person and it mistakenly touches you or pricks you. So what I'm trying to say, that infected, it must come in contact with an infected person. Then the next one is sharing items like razor. Maybe because we are friends, we are sharing razor. Those is not good. Anything sharp object that can actually be invasive, it shouldn't be shared. Then breastfeeding. Yes, a mother can actually give the child hepatitis B and C. Yes. So the next point is the one I'm going to talk about now. I'm done with B and C. The next one I'm going to talk about now is hepatitis D. Hepatitis D is actually a serious liver disease. You understand? When I mean serious, it's serious. And there is one thing you need to know about this hepatitis D. This is a serious liver disease that only occurs among people that are infected with hepatitis B virus. What do you understand? What I mean is that once someone tells you I have hepatitis D virus, it means the person is infected with hepatitis B already. Do you understand? Hepatitis D doesn't just occur independently like other hepatitis. There must be hepatitis B that must have led to hepatitis D. Okay, so how is hepatitis D transmitted? It's transmitted through the transmission requires infected blood. Yes, infectious blood. It requires infectious blood. So how does this transmission actually takes place? It takes place through intravenous drug among intravenous blood abusers. Yes, people that abuse drug, they tend to administer intravenous like drugs through the veins by themselves, and they kind of, you understand, they don't take care of because they are not health worker, maybe because they are not professional, so they don't take necessary precautions. So it's actually more common among drug abusers. Then the next point is receiving multiple blood transfusion. Yes, once someone that takes blood transfusion is multiple drug transfusion. Yes, infected blood transfusion, you can get it through infected blood transfusion. Remember the cause, I said that the blood, it requires infectious blood. So I'm done talking about the hepatitis. So what I'm going to talk about now is the treatment. So what are the treatments for this hepatitis? Because I know some of you must have heard this one is curable, this one is not. So which one is curable and which one is not curable? Okay, so I'm starting with hepatitis A virus. Hepatitis A virus, there's actually no specific treatment for hepatitis A virus, because the body takes care of it. Like, the body clears it off on its own, because it's actually a short-term infection. Yes, the body takes care of it, so there's no specific treatment for this. So hepatitis B virus is of two types: acute and chronic. Acute is when the body is able to clear it within 6 months. But when it has entered chronic, that is from 6 months and above, the body is not able to cure it. Once it has passed 6 months, it's now chronic, and this one doesn't have a cure. Yes, it doesn't have a cure. It's just to be managed. Okay, and once it has gone bad, it requires liver transplants. And one thing about liver transplants in this kind of patient is that reinfection is very possible, because it's in the blood. Yes, it's actually blood borne, so it's in the blood. So you can actually, once you get a transplant, the new liver is still going to be infected. So like I said, the hepatitis B is of acute and chronic. The chronic is acute is when the body is able to clear it within 6 months. Well, once it has passed 6 months, it's chronic. It has no cure, but it has vaccine. So please, if you know you are hepatitis B negative, go and check yourself. If you are negative, please go get the vaccine. Please get the vaccine, is important. Thank you. The next point is hepatitis C virus. Hepatitis C virus is actually curable. Yes, it's curable with oral medications, which can last from 2 to 6 months. So, but one thing about this hepatitis C virus, people that has hepatitis C virus doesn't know, because it is asymptomatic. Like, it doesn't show, you don't feel anything. It takes decades. Do you know what it means? Decades, like tens of years. It takes a lot of time, like tens of years to show. And when it shows, a lot of damage has been done. So let's try and be testing ourselves frequently to find out one or two things about ourselves. So like I said, it's curable. It's oral medication, which can last up to from 2 to 6 months. The next point is hepatitis D virus. Remember what I said about hepatitis D virus? Someone cannot have hepatitis D virus independently. The person must have been infected with hepatitis B virus too. So hepatitis D virus has 2 types, which is acute and chronic. Acute, the body can actually clear it within 6 months, but if the body doesn't clear it, it has gone to chronic. So that's it about hepatitis B virus. Then the next point is hepatitis E virus. Hepatitis E virus it resolves on its own. It's not a serious liver disease. It resolves on its own. The next point is false beliefs, myths about hepatitis. So one of the false beliefs about hepatitis is that you can get hepatitis through shaking of hands and kissing. Because you can't get any type of hepatitis through kissing and shaking of hand. Then the next point is that another false belief is that hepatitis is genetic. Please, it's not genetic. It can only be transmitted maybe from, you understand, there is a means of transmission. It's not genetic. Then the next point is that all the hepatitis has vaccine. It's not true. Not all the hepatitis has vaccine. Then the next point is that people with hepatitis normally have yellow eyes and yellow skin, which is not true. You know, the yellow eyes and yellow skin, that's jaundice. It's not true. People with hepatitis C virus, it doesn't really appear, they don't really have that jaundice, so it's actually a false belief. Someone might be having hepatitis C and not show this jaundice. So this is all I have to say about this, what you need to know about hepatitis. So you can actually go through the video again in case you have any question. Remember, I said there are 5 types of hepatitis: A, B, C, D, E, and all of the causative agents is named after them. Hepatitis A is caused by hepatitis A virus. Hepatitis B is caused by hepatitis B virus. Very simple. So and I said a lot of things about them, so you can actually rewatch the video, share this video, so because the rate of hepatitis infection is increasing actually, so it's good to actually share the news. So thank you so much for watching. I'm still Queen Chimax, also known as Nurse Chimax. So thank you so much. Remember to subscribe if you've not subscribed, like this video and share it. Thank you very much. I love you.